Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis. I'm Lita.
I'm Ron.
And I'm Jean Marie.
Collectively, we are the hosts of PodcastDX. On today's show, we're speaking with Dr.
Myriah.
Okay, thank you.
Hinchey,
thank you again. Dr. Hinchey is a naturopathic physician and fellow of the Medical Academy of Pediatric Special Needs, MAPS. She is a recognized expert in the field of Lyme disease and other complex chronic inflammatory conditions. With over 17 years of specialized experience, she's the doctor you want to see. As a physician and the medical director at TAO, an integrative center for healing, she has successfully guided thousands of patients toward recovery from their complex chronic inflammatory conditions. Additionally, she is the founder and owner of LymeCore Botanicals, a herbal medicine company focused on providing effective solutions for healing vector-borne diseases. I love that. Dr. Hinchey is dedicated to treating patients of all ages with a specialty in pediatrics and is also a sought-after speaker, passionately educating healthcare professionals on the pathophysiology of vector-borne diseases and how to successfully integrate functional, herbal, and lifestyle medicine into their practices. Quite the
resume
there. Welcome to our show, Doctor.
Thank you for that introduction, and thank you so much for having me. I'm excited to be here with you guys today.
Yeah, I'm glad you're here. I'm really excited about hearing what you have to say. Blown away by your bio. That's amazing. But let's get started. What led you to a career in medicine?
So this is actually probably one of the longest answers that you're going to get because it is a very long, convoluted journey. So I started out, my grandfather, who I was very, very close to, had a stroke when I was in undergraduate. I think it was my second year of school. And so his insurance wouldn't pay for him to have physical therapy because he was a veteran and he didn't have mainstream insurance. And so I went with my aunt and my mother and my grandmother, and we actually learned from the physical therapist that was in the facility how to give him physical therapy every day because he was paralyzed on one side of his body. And so I kind of fell in love with physical therapy, and I decided that's what I was going to major in. So I had gone to the University of Connecticut and just kind of was doing generalized studies. And so the physical therapy school, the School of Physical Therapy at UConn was very, very competitive, and you got, certain points for doing a variety of things on your application. And one of them was working at a physical therapy office. So I got a job as a receptionist part-time at a physical therapy office, and they had massage therapy there. And I kind of then fell in love with massage therapy. And then I became a PT aide, and I started doing like the hands-on, like craniosacral stuff, and just really, really liked it. And then also you couldn't really work during the program because it was so intense, and I really needed to work to be able to, to pay to live while I was going to school. So I decided to take 2 years off and went to school and became a licensed massage therapist. And while I was in massage therapy school, really fell in love with the Eastern philosophy of medicine. So preventing disease, right? And using herbal medicine, using Chinese medicine, using all these hands-on modalities to prevent and heal the patient instead of just treating symptoms with pharmaceutical medicines. And also the prevention piece just really made sense and resonated with me. So I finished that up and came out of that and went back to UConn, no longer wanting to be a physical therapist. I wanted to get my license in acupuncture. I wanted my master's of nutrition. I wanted to learn more about botanical medicine. And I had this idea that I was going to do this, hands-on psychotherapy, like this new therapy because of the whole mind-body connection and how our bodies hold on to, like this muscle memory that can keep us sick. And so I decided to switch my major to psychology. And one day while I was doing massage therapy on the weekend, I had this woman come in. And, I'm thinking like, I'm going to be in school forever, right? All of these degrees, like at least 12 more years of schooling. And this woman comes in and she's like, oh, I'm so stressed out. I'm studying for finals. And I'm like, oh, what are you going to school for? And she was like a naturopathic doctor. And I was like, what's that? She's like, oh, we do nutrition and acupuncture and botanical medicine. And I was counseling, psychotherapy, and I was massage. I'm like, what? I didn't even know, like, I'm embarrassed to say, like, so I was like in my 20s and I had no idea what a naturopathic doctor was. But from the moment I met that woman, I knew that I was going to be a naturopathic doctor literally from that moment on. And I did.
Well, that's excellent.
So wasn't the straight path? It was winding and narrow,
but all the pieces
Fell together.
Yeah.
fell together.
Right.
It was
And
like a puzzle that you didn't know what it was going to be at the end. They didn't give you the box, so you had no idea what it was going to look like, but you knew what parts were going to go into it. That's excellent.
Yeah. I'm not sure if Lita knew, but we met in grad school in rec therapy. And when I started, I was in my 30s. And I really didn't know what it was until I actually got into it. But that's where Lita and I met 25 years
I don't
ago.
know, a while.
Wow, that's
And
awesome.
It, like you, I mean, I had a completely different background before I got into what I was doing. And as you keep saying, falling in love with it, I fell in love with it and been doing it the last 25, 30 years. So we're glad that you found what fits you.
Yeah, right.
So that's fantastic.
It's funny. There's one other little caveat. So like when I was my last semester, I believe, or it could have been my first semester of my last year, I needed an independent study in psych, and there was only one spot open, and it was working with this TA. Her name was Diana Robbins, and she was working on the MCHAT, which is the checklist that a lot of pediatricians now use to diagnose autism. It's a screening tool. And so I used to sit there in her office after my classes and like grade all of these checklists that we would collect from the local pediatrician offices. And then if one of them was flagged, I would call the parent, invite them in for an evaluation. And it's just funny because had that not happened just by pure luck, I never would have, well, maybe I would have, because you know how the universe works. But this was, at the time when autism was still, like 1 in 10,000, not the 1 in 32 that it is today. So, seeing that rise in rates of autism over, so many years is actually what, when I got out of medical school, made me find and do my first mentorship with Dr. Nancy O'Hara, to learn more about autism and how to treat it, because I do believe in the biomedical intervention and healing of autism. It's not something that, is a mental disorder and you're just stuck with for the rest of your life.
Wow. We got to have you on for another show for just that, if we may.
Exactly.
Yeah.
I'd love to.
Great. Well, I know that you already touched on a little bit about naturopathic medicine, but could you tell us a little bit more in detail what naturopathic medicine is?
Sure. I would say like the simplest way to understand is that it's just using natural means to help to correct the physiology in the body. I think that's the easiest way to put it. So these could be nutrients from like supplements. This could be diet. So avoiding certain foods, but making sure that you're eating certain other foods. It could be herbal medicine. It could be homeopathy. It could be acupuncture, massage therapy, hydrotherapy, just all of these various natural means to help to correct an imbalance in the body. The way that I was trained and the way I believe naturopathic medicine really should be is focusing on identifying the root cause of illness and then using whatever means are available to that particular patient to help to resolve it. And, a lot of times it boils down to one of two things. Either there is something there in the body that shouldn't be there that is upsetting it and causing like an immune response or something to go awry in the physiology, or the body is missing something that it needs to function properly. And oftentimes one will lead to the other, and you'll have a combination of both. And really, like, I hate to simplify our super intelligent, incredible bodies, but it really boils down to that.
Okay. And when should someone consult a naturopathic physician versus like an OD or an MD? Or can you see all three?
So I see room for all three. So I do not like it, and I do not recommend that patients do not have a primary care physician. So I am a specialist in the state of Connecticut, and I prefer to be a specialist. I don't have time to do all of the things that a primary care physician does, nor do I want to. If I wanted to, I would go to traditional medical school. So I think that everyone should have a primary care physician for the various things that are needed for that. And then, I would recommend having a naturopathic physician because unfortunately, we are not taught anywhere in life how to eat correctly and how to live a healthy lifestyle. These recommendations that are handed down from our government are not meant to keep us healthy. And I don't mean for that to sound like such a controversial statement, but the food pyramid, the plate, all of that stuff is complete nonsense. And eating that way is why we have so much chronic disease in our country and in our world. So I feel like working with a naturopathic doctor and really understanding how our bodies work and what our bodies need to function properly will help and go a very long way with preventative medicine, right? And then you have your primary to do all of your screenings and handle, anything acute that might need antibiotics or some sort of other prescription medication. And then whether you want to have a DO to make sure, that your musculoskeletal system is healthy, or you would like a chiropractor, I think that everyone should have a team that they trust and that they resonate with.
Okay.
Okay, yeah. So you've got an amazing background. Thanks for sharing the story of how you got to where you are. But can you tell us what sparked your interest in the care and treatment of people that have Lyme disease?
Sure. So there's many answers to this question. I would say number one, so being trained to find the root cause, right? So if I'm looking for the root cause, and there are a lot of people that have vector-borne disease. Now, I live in Connecticut, which is ground zero. I want to make it clear that Lyme disease has been found when they have collected ticks from every single state in the country. So, I don't want to give the misinformation that Lyme is only, in certain states. It's all over the country. It's all over the world. Okay. Number one, but being here in ground zero and a lot of times not being able to literally walk through your lawn without getting a tick on you, when you're looking for the underlying cause, for me, at least, a lot of times for my patients who are here in Connecticut, it's Lyme, Babesia, Bartonella, Mycoplasma, Ehrlichia, Anaplasma. Those are the main organisms that are carried by ticks. Bartonella is also carried by fleas and mites. And there's a lot of, controversy as to if there's other insects that can carry some of these things as well. Some of them can be passed through the placenta, so they can be given to children congenitally. And also, Lyme, Borrelia, is the cousin to syphilis, and syphilis is a sexually transmitted disease. And so when you have an organism that causes or that acts the same, you really have to question if that is a viable route of transmission too. So, back to why I specialize. I'm trained to find the underlying cause, and I would get a lot of patients who would come in with atypical diagnoses. So for an example, someone coming in with MS, but yet their labs show no evidence of autoimmune. They do not have lesions in their cortex and in their cervical spine and in their thoracic spine. You're not seeing the diagnostic criteria line up. So they get that atypical diagnosis. And basically their diagnosis is just being based off of the symptoms. But Lyme is the great mimicker. It's the great imitator. Lyme Borrelia infects every single cell in the body, and therefore it has the ability to alter the function of every single cell in the body, which then means every organ in the body, every organ system, and every system. So I have a lot of patients come in that have severe neuropsychiatric symptoms like seizures, insomnia, anxiety, depression, obviously like headaches and things like that. But, they have all of, and then they also are having like hot flashes or night sweats and, some joint pain and some aches and maybe heart palpitations. And it's like, what makes more common sense, that you have one infection that's rampant around here and easily transmitted, or that all of a sudden, all systems in your body are simultaneously imploding at once? And a lot of these people are in their 20s and 30s, right? So it just doesn't make sense.
Wow. I guess as a follow-up question to what I just asked, what is your suggestion, or what should somebody do if they happen to find a tick on themselves or even on their pets? What's the first thing they should do?
The first thing that they should do is properly remove the tick. So we don't want to squeeze it by its body. We don't want to burn it with a match. We don't want to use a little twisty tool. We don't want to do anything that's going to agitate that tick, because when it regurgitates its contents into the body, that is when the transmission is most highly likely to occur. So what happens is these bacteria that cause Lyme live in the hindgut of the tick. And when the tick takes in the person's blood, its blood meal, that mobilizes these spirochetes up to the salivary glands, right? And so now once they're in the salivary glands, they are more likely to transmit with they inject in an anesthetizing agent in their saliva and a blood thinner, and then they pull the blood, and it's kind of this back and forth exchange. So it is not true that a tick needs to be on you for 24 hours to contract any of these diseases. If the tick was partially fed, you can get any of these diseases immediately. Powassan virus, which is on the rise, can actually be transmitted in 15 minutes. And all of these other vector-borne diseases can be transmitted within 24 hours. So how you want to remove the tick is you want to get a pair of fine-tipped or flat-tipped tweezers, and you want to go as close to your skin or your child's skin as possible, and you want to grab the tick by its neck. So as close to the skin, grab it by the neck, and you don't want to pull in like a ripping or a jarring motion. You just want to lift it up till you see the person's skin kind of tent, and then you just start counting. Usually that tick will release itself within 90 seconds to about 2 minutes. Oh. And when it does that, it comes out without regurgitating its contents in. Number one. Number two, you want to clean the area with hydrogen peroxide. I like to make a mixture of bentonite clay and an herb called Andrographis, which is anti-spirochetal, and put it on the bite, because the clay has some drawing motion to help to draw the saliva out. And Andrographis is anti-spirochetal, so you can kind of topically kill any of the spirochetes that are there. And then I always say send the tick out to be tested. So there are companies like tickreport.com, which is at UMass Amherst. And if you send the tick out, now you know what you could potentially be dealing with, because your tick could be clean and then you don't have to worry about anything. Right. But if the tick comes back with any of these tick-borne infections, now you will know specifically what pharmaceutical antibiotic or herbs you want to use. Because, for example, doxy doesn't kill everything. Doxycycline is good at getting Borrelia and Anaplasma and Ehrlichia, but Babesia, which is a parasite, doxycycline doesn't treat Babesia. Babesia needs to be treated with anti-parasitic medications.
Gotcha. So you're suggesting then to take it off, but in a gentle way instead of ripping it off, making sure you do it the way you suggested. and get it tested rather than tossing it out, because if you toss it out, you may have something you do not know what it could be. If you send it in to get tested, it could come back negative, or it could come back and you know exactly what you're dealing with.
Exactly. And we cannot rely on the erythema migraines or EM bullseye rash. That rash only occurs with Borrelia, and it occurs in less than 20 to 40% of known cases of Lyme disease. So a lot of people say, oh, you don't have a rash, or it doesn't have central clearing, or it doesn't look like a bullseye. And it's like you just cannot rely on that. Also, it can take that rash 3 to 30 days to develop. And that's a big span of time.
Wow.
And if you're one of the ones that you're going to take 3 to 4 weeks for that rash to develop, then you're already going to have disseminated Lyme at that point. It's already going to be everywhere in your body. Now, the other thing is that if that EM rash is there, that is 100% diagnostic of Lyme disease. It doesn't matter what your test says. And since we're talking about testing, it's important to note that the testing, there's big problems with the testing. Number one, there isn't a direct test that is commonly used to look for the bacteria Borrelia that causes Lyme disease. What is looked for is antibody production. So it's called an indirect test. So they're looking at the immune system's production of antibodies, or the immune system's response to the bacteria to get a positive or negative test. And what's important to understand is that it takes about 3 weeks for the antibody called IgM to be produced in levels that are high enough to get a positive test. And it takes 4 to 6 weeks for high enough levels of IgGs. And so the typical scenario, if a person is lucky enough to find the tick that bit them, is that they find the tick, they go to the doctor, and they get tested within, a few days, within maybe, let's say, a week of when that tick attached. And so a lot of times they get a false negative. And then from that point on, no matter what symptoms develop and how much it looks like Lyme disease, the doctor's like, well, but we tested you and you were negative.
Yeah.
Mm-hmm.
And for the sake of time, I won't go into all of the other flaws with testing as well. But I would say that's the biggest, testing too soon. You've got to know when the opportune time to test is. The other one that I'll mention really quick is that, like if you are using a conventional lab, they're looking for Borrelia burgdorferi. So that's the original species of Lyme. There are other, 18 or 19 other species of Borrelia that cause Lyme that aren't looked at with those tests. So it's like me telling you, I'm going to have you here. I have a box of crayons. There's 20 different colors. Reach into this box, pull out a crayon, and you pull out a green one. And I say, okay, now I'm going to test you for that green crayon, and I'm going to just tell you if you have a crayon or not. But my test is only going to pick up a red crayon. So I'm going to test you for a crayon, and I'm going to say, nope, you don't have a crayon. And you're going to say, I'm holding a green crayon right here.
Right.
I have a crayon, and I'm going to say, nope, it's not red, so I can't see it. Therefore, you don't have a crayon.
Okay.
Wow. Well, we were going to ask about the accuracy of current lab tests, but
you answered
you
that.
answered that for us very, very well. Is there a point where you can say it's too long of a distance in time since the bite that the test will never show anything? Like 6 months after the tick, there's nothing in your body that's going to show it anything up?
No, that's not the general understanding, and that's definitely not my experience. I have people who have been infected for decades who are still testing positive, who in fact never were diagnosed. They, diagnosed with fibromyalgia or chronic fatigue syndrome or atypical fill in the blank.
Wow.
And so IgGs will stay around for a long time. And so I think part of the controversy with Lyme disease is really it boils down to the testing. And I think a lot of doctors will say, well, once you have Lyme, you'll always test positive because IgGs can be there in the form of memory cells. But there are companies like IGeneX and companies like Vibrant, for example, who look at, first of all of the species that can cause Lyme disease. And then they also look at all of these other co-infections, because it's important to point out testing for Lyme doesn't test for co-infections, right? Like we have to test for each different organism. And so when you use these other labs, they will actually quantify. So it doesn't just say reactive or non-reactive for each antibody like conventional labs do. They will either give you a number or they will give you 1, 2, 3, 4 pluses so that you can see, you know, how strong of a reaction there is. Because if someone is running around with very high IgGs, it isn't memory cells, you know? If you have very low IgG production and no IgM, then sure. Oh, and if you were treated for it, then it could be memory cells. But Lyme isn't one of those things usually that is going to be self-eliminated.
Okay. And going from there, Dr. Hinchey, what are the typical symptoms for someone may experience if they have contracted Lyme disease?
Okay. So keeping in mind, right, that Lyme can infect every cell in the body and therefore affect every cell. There are symptoms in every single system of the body, but I'll start with an acute infection. Okay. So in an acute infection, typically it's just you don't feel well. You feel a little lethargic, you feel a little unmotivated, you might have some sensitivity to your environment, you might have a stiff neck. It's general flu-like symptoms. And then sometimes people will just kind of feel better and go back to normal. And then a few months later, it's like all of like the neurological stuff or the cardiac stuff can kind of come in. And Lyme is funny, because it's one of those things that the symptoms come and go. So they're intermittent and they are cyclic. And so typically one of the hallmark signs is that it comes in one. So like, let's say you have severe shoulder pain, where, to the point where you think like, my God, did I tear something in my shoulder? Like it's that painful. And it comes out of nowhere and you know you did nothing to it. But then all of a sudden, 2 days later, it is just gone. It's not like, oh, it gradually got better. It is just gone. But now, like your knee's hurting, or all of a sudden you have heart palpitations or digestive issues or headaches, right? So it's like this weird ping-ponging around the various systems of the body. And a lot of times you will see a general decline in somebody's immune system that gets worse over time. So that can look like kind of just catching everything that's around you, you know, or it can look like poor wound healing. So, you know, you go for a walk and like a long walk or a hike and you feel like you ran a marathon, or, you know, you do something where like you really shouldn't expect to feel it the next day and you feel it the next day. Or you have surgery and you're not healing at the rate that your surgeon expects you to heal in. So like you have to realize that Lyme causes immune dysfunction and massive inflammation. That's how it lives in our body and is able to become chronic. And it also feeds off of our collagen. So the exact nutrients that these spirochetes, that Borrelia needs to live and to thrive are contained in our collagen. So it breaks down our muscles, our tendons, our ligaments, our cartilage, our blood vessels, our organs, our brain, our gut, because it wants the nutrients from the collagen.
Okay. And Dr. Hinchey, what is the typical course of treatment for someone who's been diagnosed with Lyme disease?
So if it's caught immediately, and we're talking about an acute case of Lyme disease, the appropriate treatment, as long as they're not under a certain age, is 4 to 6 weeks of doxycycline. Okay. And that, again, is in an acute case. And again, if it's a virus, antibiotics don't treat viruses. If it's Babesia, which is a parasite, antibiotics don't treat parasites. So just answering your question specifically with Lyme disease, that's what it would be. Okay. Once it has gone chronic, then it's different. Then you actually have to, if you're going to go the pharmaceutical antibiotic route, you have to be on something to treat the motile form, the intracellular form, and the round body or the cyst form, because it lives inside of our bodies in 3 different forms.
Okay.
This kind of sounds like a remedial question now, but how important is it to get immediate care? Again, you talked about if you find a tick on you, how to take it off and get it tested. But if you find out it comes back positive, I mean,
Immediately.
that's why I said it sounds like a remedial question given what you told us.
Right.
Listen, I think antibiotics are wonderful when used appropriately. They're life-saving, right? But I don't believe in using antibiotics unnecessarily. Our microbiome is responsible for at least 70% of our immune system's function. And when we take antibiotics for no reason and we kill all that healthy bacteria, and it leads to dysbiosis and, all sorts of issues with gut functioning, that really impacts our immune system and causes immune dysfunction. And so that isn't going to help anybody, but it is better to prevent Lyme disease using the pharmaceutical antibiotics if you catch it quickly enough. Mm-hmm. It is much better and easier to prevent than it is to try to deal with a chronic case after the fact. So I am all about using antibiotics as quickly as possible if you are either symptomatic or if your tick tests positive and the test shows that it was at least partially engorged. So, UMass, thetickreport.com, they get your results back to you within about 48 hours. Wow. And that is still within the window where antibiotics can prevent the infection.
Okay, that's great.
But it's important that you take them for the right amount of time. So, some doctors are relying on this study that was done a long time ago that was very improperly conducted, where giving 1 dose of doxy at the time of a tick bite was said to prevent Lyme disease. And I won't get into the flaws of the study, but that's just not true. But that's still how a lot of doctors, even here in Connecticut, are handling these tick bites. There's a lot of local physicians who are still giving 2 weeks of doxycycline or another antibiotic, and it's not enough. The life cycle of the organism, the spirochete, is at least 21 days. And so the reason why we have different antibiotics and we stay on them for different lengths of time, depending on our diagnosis, has to do with how that organism replicates itself. And so Lyme disease is a very slow growing, slow replicating organism. And so you have to be on the antibiotic to get through its entire replication cycle to be able to effectively kill it and its offspring.
Okay. That makes a lot of sense. And Dr. Hinchey, what can individuals do? We're talking about, preventing a chronic case, but what can we do to stop even getting tick bites or other insect bites? And what
live
do
in
you
a bubble.
do there? Okay. Yeah, never go outside again. But what do you do to prevent getting ticks on you or from biting other biting insects?
So insects in general, I like using various concoctions of cedar essential oil, lemongrass, calendula. I have these various different concoctions that I use made by different companies. And that's for spraying on myself personally. This is an individual choice. I choose not to spray toxins on my body, okay? But I also used to be an avid rock climber, hiker, did a lot of things in the woods. And after I ended up with Lyme, Babesia, and Bartonella and Mycoplasma all at once, I don't really love going in the woods anymore. And it used to be, aside from the ocean, it was like my number 2 happy place. So, to me, being a fully functioning human is way more important than going in the woods for me. If you're someone that's going to go in the woods, or if I had to go in the woods, like deep woods, I would get the socks that are available by Insect Shield that have been dipped in permethrin, or I would put permethrin around the soles of my hiking boots or shoes, being very, very careful not to get it on my skin because it's a neurotoxin. It's a poison.
Right.
So I use the essential oils to spray my body. Now, to take care of our yard, we use an extract from chrysanthemum called pyrethrum, which, is safer. It's considered organic, even though it's not, what I would consider to be organic, but in the world of, the environment, it's considered organic. And that's what we spray our property with at least 3 times a year. Then in between, we use organic cedar oil.
Okay.
Tick tubes are amazing. They used to be super expensive to purchase. So a lot of people would make them themselves. You can save the cardboard from your toilet paper rounds or your paper towel rounds. And then you get that permethrum, the toxic stuff, and you soak cotton in it and you wear like double rubber gloves and you stuff these tubes with the cotton and then you put them all around your property. And what happens is the mice will take the cotton back to their nest and the birds will take the cotton back to their nests, and it doesn't harm the animals. But what it does is it almost like front lines them, and then it kills all of the little nymph and larva ticks that are on these animals, because everyone thinks about the deer, but it's the white-footed mouse and these birds that carry the little teeny tiny ticks that are like the size of a poppy seed that you cannot even see, especially, like when they get in your hair and whatnot. And then obviously they cannot grow into adult ticks and lay eggs if they're being killed at this very young stage. So tick tubes are amazing. You can actually get them pretty affordable now, just even on Amazon. And so ticks love moist, shaded areas, right? And mice love stone walls. So where I am, there are stone walls everywhere. It's like everyone's land is literally bordered by a series of stone walls. And so putting these tick tubes in the stone walls, also cutting the trees back so that your lawn gets direct sunlight. The ticks will dry out. They cannot stand being in direct sunlight or heat. So a lot of people think they only have to worry about ticks in the summer, but actually once it's hot out and once there's a lot of sunshine, the ticks don't really like the environment, and they're going to be hanging out kind of like in the outskirts of the lawn where there's shade, where there's leaves. And so I always say to parents, don't put your playscapes under a big, beautiful shaded tree, because you're literally creating a tick habitat for it. So I think those are the biggest things: keeping your lawn raked, keeping the grass cut, to a normal level. That can really help to decrease the tick population. But if you have mice scurrying through your yard and you have birds flying and, landing in the middle of your yard, the likelihood of ticks getting dropped off or scratched off there are huge. And, bird feeders attract birds, which drop ticks.
Okay. Good point. And Dr. Hinchey, could you tell us more about your practice? And is it pronounced Tao as in Taoism?
Yes.
Okay.
So my practice is in Hebron, Connecticut. Currently, we are 3 naturopathic doctors who specialize in Lyme disease and other vector-borne illnesses. We have a psychotherapist who specializes in trauma and uses a lot of EMDR for therapy to help process trauma. We have massage therapy and acupuncture. And we also have hyperbaric oxygen therapy and far infrared sauna, and a lot of different therapies to help to soothe and stimulate the vagus nerve to help people to get out of that chronic flight or fight, sympathetic dominance that a lot of chronically ill patients have.
Okay. And what can a new patient coming into your practice do to help facilitate their care?
That's a tough question.
Okay.
So I only see patients that have vector-borne disease at this point in my career because I have a very long wait list. And a lot of these patients have been through the ringer. A lot of these patients have seen, I would say anywhere from 5 to 16 other doctors, and they've gotten what I would call, bullshit diagnoses. And a lot of them have literally been told that they're crazy and it's all in their head. And so they're searching and they're frantically searching. And typically they will have found my name in a chat room on social media or something like that. And I think my biggest piece of advice is to find somebody, first of all, that knows what they're doing. Secondly, that you feel comfortable with and that you trust. And then you got to give it over to them. Because being in this frantic searching, I got to take care of myself because nobody else is going to take care of me and I'm never going to get better. That frantic mode, that sympathetic fight or flight state is going to be one of the biggest hurdles to getting them better. Because if we are constantly stuck in fight or flight in stress mode, our immune systems can't function properly. And if there's one thing that everyone listening to this takes home with them today, it's that in the end, it doesn't matter if what you decide to do for your treatment, it is your immune system that either gets this infection completely out of your body or gets it into remission. It's your immune system. So if you don't fix your immune system, you're going to be one of those people that once you have Lyme, you always have Lyme. So we have to recover the immune system and fix the immune system dysfunction to get this into remission.
Okay.
Yeah, that's some great information. I got to agree with you. I think we should all live in a bubble.
The biggest fight that my husband and I had when we had a baby was he was like, are you ever going to let his toes feel grass? And I was like, yeah, once I know that he is neurotypically normal, that he can walk, he can talk, and there's nothing else wrong with him. Yes, then he can walk in the grass because I'm not going to have somebody tell me, that he has X, Y, and Z when really, he got Lyme disease.
So a lot of it sounds like you need to self-advocate.
You do.
I mean, you go to a doctor and they tell you one thing, but if you don't feel comfortable with their response, then you got to search out somebody else. Maybe not to get the answer you're looking for, but if it doesn't make sense to you, you can't just listen to like your primary or the first person you go see. It's finding that right person like you that can tell you what's really going on.
Right. And I think that that's true really with any part of medicine. If you just want to look at metabolic syndrome and obesity and diabetes, these are all environmentally induced conditions. Right. You might have a stronger predisposition because your mom or your dad had it, or your grandmother does, and you have certain genes, but your genes do not dictate your destiny. It's the interaction of your genes with your environment. And so, what you're putting into your body and what you're not putting into your body, and then what you're exposing yourself to in the realm of chemicals and infections and all of this other stuff, it's like straws on the camel's back, right? And the camel's back is the immune system. So we've got toxins and we've got lack of nutrients and we've got parasites and bacteria and viruses, right? And at some point, it's like the body can't function like that anymore. And then chronic disease sets in. So I think being our own advocates, all of us being our own advocates, and educating ourselves on really what do our bodies need and what should we make sure our bodies don't have? And there are some simple markers that you can get through a conventional laboratory that tell you, pretty in depth what's going on with your immune system and what's your inflammation status. Are you making antibodies against yourself, like these autoimmune antibodies? And they're kind of just these first little red flags. And if you find them when they're just these little teeny tiny red flags before your whole body is self-destructing, there's a lot that you can do about it. A lot of these chronic diseases in our country, they're reversible.
And what advice do you have for current or prospective medical students or individuals seeking a career in the medical world?
I would say to really think hard about why you want to be a doctor. Mm-hmm. Or whatever, if we're not talking about a doctor, we're talking about, PA or an APRN or, anyone who is going to do hands-on patient care. Why? Mm-hmm. Why are you doing it? And what do you want to do? What do you want your role to be? And if you're happy simply checking off symptoms and lab work and making a diagnosis and matching that person to the appropriate pharmaceutical to manage that condition for the rest of their life, and that makes you happy and that's what you think medicine is, then that's what you should do. But if you want to actually heal somebody and you want to understand the physiology and the pathology and biochemistry and how and why the body works and how and why diseases develop, and you want to be able to reverse that and actually heal somebody, I'm so sorry, but like conventional medicine doesn't do that anymore. And I think that a lot of that is because of the system that we're in and the restraints that are imposed on doctors by insurance companies. If you get 6 minutes with your patient, how are you supposed to teach them anything about their disease? Doctors are stressed and they're overworked and they don't have the time that they need to actually help their patients. And it also goes down to medical school. You get a couple hours and you can ask any MD how many hours of nutrition they take and their fundamental understanding of how nutrients actually run our biochemical pathways in our body. Like, you eat something that has tryptophan and you convert it into 5-HTP and then serotonin and then melatonin. And if you're not making sure that that's happening, because let's say the patient is deficient in the nutrients that the enzymes that make those conversions are needed and they're not there, and you just stick someone on, Ambien and Prozac, okay, well, you're still not fixing those underlying, nutritional deficiencies that are causing a whole host of other issues as well. And you didn't really do anything to help the patient. So if you actually are looking as to why they're not sleeping, why they're depressed and anxious, just doing a simple micronutrient panel that analyzes the white blood cell, the intracellular levels of these nutrients is life-changing. If all of a sudden you have pathways working that weren't working, symptoms are going to go away.
Wow.
That's some great information. Thank you.
Yeah.
Now that we have a bit of background information, it's time to talk about our initiative. To better serve our listening audience, we are an affiliate of a major medical supplier here in the United States. You will find affiliate links on our website, PodcastDX. They aim to tailor specific medical supplies and equipment based on your diagnosis to make it less stressful than looking through an entire catalog for what you might need. We are open to your suggestions and will adjust our offering based on you, our listeners, what you find helpful. But now let's return to the show.
Doctor, I'm back. Sorry, I have a few diagnoses I'm working on myself. How do you maintain a good work-life balance?
Oh, well, I try to leave work at work. I have a few different businesses related to my work as a doctor. And I am very, very good at setting boundaries for myself. And I really try to practice what I preach to my patients. So when it comes to self-care, when it comes to how I eat, when it comes to setting boundaries. So I typically leave the office and, after I get home and I am in mommy mode, I don't really think about work unless I have a really big project going on, and I don't do work on the weekends. She says as she's doing a podcast on a Saturday.
Very sorry.
No, but typically I don't. This just happened to work out for me today, but typically I don't work. I don't do anything regarding work unless I'm at a conference speaking on the weekend. So I just try to be very diligent about that. And I try to be very present. When I'm with a patient, I'm with a patient. I'm not on my phone. I'm not, doing anything else. And when I'm with my family, I'm with my family. And I try to have some alone time because I think it's really important for us to be alone with ourselves.
Okay.
No, that's some great advice.
Good answer. Thank you.
And Dr. Hinchey, what do you do to help reduce stress or relieve stress?
Are you talking personally?
Yes.
Okay. So I walk at least 4 days a week, or at least that's my goal, for about 45 minutes. Okay. And used to be in the woods. It is no longer. And then I go to the ocean. So I love the ocean. I love walking on the beach, and I try to do that, as much as possible. Again, I live in Connecticut, so you're not going to find me walking on the beach most days in the winter. I also do various things. I do massage therapy. I do far infrared sauna. I do pulsed electromagnetic therapy. I end my shower almost every day with freezing cold water. And I do I love doing cold plunges. Let's see, what else do I do? I would say that's about it.
Okay. That's a nice list.
Yeah.
I was
excellent.
on board with all of that until you said
Sorry,
freezing cold
cold.
water at the end of the shower.
Yeah, that's, I mean,
And
you
the-
know, it's
the
supposed
plunges.
To be it's
Yeah,
supposed
no.
to be a really healthy thing.
It is.
It is.
It's
It's very good for helping your mitochondria.
Yeah. My neighbor will crack the ice in his pool and then jump in the winter, and it's like, oh.
Yes,
I told Lita, I actually have a trip next month with the Adapted Scuba organization that I'm involved with. We're going to Grenada, and Caribbean warm water. That's my idea of fun. But these people that go ice diving and things like that, absolutely not.
We do polar plunge once a year up at Lake Winnipesaukee. Yes, I'm one of those crazy people.
Well, that's one
If
way
it works
to.
for you.
Yeah, right. Everybody's got their thing. I accidentally fell into a frozen lake once, and I will never
jeez.
again. Never
Quite
again.
the
I
same.
don't recommend doing that.
No.
How do you say never again when you accidentally did it? If you would have jumped in, I could see that. But
Well, I stay away from frozen lakes now.
now that's good advice.
Yeah. Well, Doctor, thank you very much for joining our show today. You were really a very
Wealth of
strong
information.
wealth of
Yes.
information. How can our listeners learn more about you and your practice?
So you can go to taovitality.com. So TAO, V as in Victor, ITALITY.com. Or you can follow me on Instagram, Dr. Myriah Hinchey. And thank you so much for having me. I really enjoyed this.
Well,
Thank you.
Yeah, thank you. And thank you for taking time out of your non-doctor time. I know we really appreciate it, and our listeners do as well. And we'll add links to your website on the page for this episode.
Great.
Okay. Thank
If
you.
you have any questions or comments related to today's show, you can contact us at PodcastDX@yahoo.com. We have a website, PodcastDX.com. We're also found on Facebook, Twitter, Pinterest, Instagram, and TikTok.
And if you have a moment to spare, please give a review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you've heard of this podcast.
Till next week.